CDC just yesterday came out and said the fatality rate in total is about 0.4%. What does that mean? Well, in comparison to influenza, that is somewhere around 0.15 or 0.2%. So the overall fatality rate, at least based on current data, is higher than influenza, but what we're seeing is every week as we do more testing, as we get more data, the fatality rate is dropping. And the fatality rate for a young person is way below that of influenza. As a matter of fact, a young person has a less than 25 years old, you have a 50 times greater risk of dying from drowning than you do from dying from COVID-19, and a much higher risk of dying from an automobile accident than you do from COVID-19. We're not closing swimming pools. Don't give Governor Newsom any ideas. And we're certainly not shutting down the freeways. As a matter of fact, me driving out here today, one of the advantages of what's going on right now, no traffic. That was awesome.
Yeah, that actually is the best. But now traffic's starting to start up
a
again.
little bit.
Because,
it's still not as bad.
You know, because they were opening the economy open again. Like you said,
Exactly.
restaurants are opening, which is also funny because every single restaurant I've gone to, they make me wear my mask and social distance.
Right.
It's definitely not the restaurants
It's
really
not the
giving
restaurants.
things.
Okay, just an FYI, swimming pools are being closed because of COVID. I don't know why Barke thinks this wasn't happening, but anyways, I find it pretty obvious what he's doing here with this whole "the fatality rate is dropping" argument. He thinks the economy should reopen because COVID barely kills anyone, right? And look at the data in early July. Cases are increasing, but fatalities are not. So what's the big deal? Well, today, it's been about 3 weeks since PragerU released this video on July 9th. And in that time, there has been a significant jump in fatalities, resulting from this late June to early July case flare-up he's talking about. These deaths were not reported in early July because they hadn't even happened yet. This is what's called time lag. After you're exposed to COVID, it takes about 2 weeks for it to prove fatal, and then another week will pass before your death gets recorded. This 2 to 3 week window has proven crucial when identifying the number of deaths in relation to cases, something Barke as a healthcare professional should have been well aware of. As a result, I can only assume that Barke and people like him simply jumped the gun here, choosing to lie or at least make a faulty assumption instead of waiting for the data to prove them right, or in this case, prove them wrong. I can't help but criticize Barke for getting something so obvious so wrong. To me though, this is just another example of how misinformed he is. He also tries to say that the CDC's COVID fatality rate is about 0.4%, which is not true. I couldn't even find evidence of the CDC making this announcement, so I guess we just have to take his word for it, right? Well, regardless, if we check the data available on the CDC website, it shows the fatality rate in America overall is much higher than the figure Barke gave, about 3.5%. Granted, there are far more fatal viruses out there, but as I've already mentioned, getting infected may not give you long-term immunity, so it's better to avoid the illness as best you can. And even if 96% of people survive COVID, there are still those who are going to get permanent nerve and lung damage as a result of their infection, and now have to worry about a burdensome level of healthcare debt. Sure, most people will survive COVID, but there's a big difference between survival and life returning to the way it used to be.
And they were starting to open things back up, and now they want to close everything down again. We saw an increase in cases in places like Texas and Florida, and they're saying right now Orange County as well.
Yes,
Are the
yes.
hospitals overrun in these places?
No, they're not overrun. You know, obviously I know my hospital system the best, and that's Hoag Hospital. They're not overrun. So what's happening, if you and I walked out of here and you fell and hit your head and you ended up in an emergency department, they would test you for COVID. And if you were to test positive for COVID, even though you have no symptoms, you're now a hospitalization for COVID-19. That's what we're seeing. In addition, we've now opened up healthcare facilities for what was previously shut down as considered non-essential. So somebody now going in for shoulder surgery or knee replacement surgery or whatever it is automatically tested for COVID-19. And if they're in the hospital and they test positive, It's a hospitalization for COVID-19. So we're seeing less emergency room visits for acute illness. We're seeing less ICU admissions, that's what I mean. We're seeing more people coming into the hospital for the elective procedures and so forth that were previously deemed non-essential. And the length of hospitalizations for COVID patients is dramatically reduced because we're a lot better at treating this.
Okay, I find Barke's statement here to be very misleading, not only because he's lying, but he's even using the way his hospital operates to make a blanket statement about hospitals in general. So for one thing, yes, Hoag Hospital Presbyterian is not overrun with COVID patients. According to one source, only 5% of their beds are in use. They're still treating a lot of COVID patients though, and they're doing this by sending them home to self-isolate as outpatients. If their condition gets worse, they're free to come to Hoag Urgent Care and/or Hoag Medical Group offices, which are separate buildings from the main facility. This allows Hoag Hospital to work with everyone else. There are still beds being used to treat COVID, they're just not in the main hospital. So Barke's correct here. His hospital is technically not overrun, but not all hospitals work the same way. Some get more traffic than others, and the reality is some are struggling to manage COVID. And even hospitals that still have a large number of beds available, many of them accomplished this by expanding their treatment capacity. This means more beds, more facilities, but also the expectation they'll have more patients in the future. So just because a hospital has not reached capacity, they could still be treating a significant number of COVID patients already. And as surges in COVID become more frequent, even this expanded capacity could fail, a concern that becomes all the more real as cases continue to rise. Barke also said that the spike in cases we're seeing is, at least in part, the result of a lot of people coming to urgent care as asymptomatic cases. They tested positive though, so they count as a case of COVID in the national data. Well, while it's true that testing has expanded greatly in the US, we've already covered the fact that an early July spike in cases had been quickly followed by a surge in fatalities. And yes, it's true that COVID has mostly infected a younger age group now, and this young age group tends to be more likely to recover from COVID. And yet, researchers still detected a spike in fatalities to match cases, which tells us that this early July COVID resurgence can't be explained away by expanded testing, a younger age group, or the protests. We have to acknowledge that more cases is going to mean more deaths, and a reopened economy allowed this to happen. Weaker regulations allow more people to interact socially, and it's this social interaction that helps the virus spread. Based on the evidence I'm seeing, there's no talking around the fact that COVID is a serious health hazard, and a reopened economy has only prolonged that crisis.
In terms of the masks actually helping stop the virus, what are your thoughts on that?
You know, I don't want to get too controversial. The mask issue has really been beat up. My personal opinion is masks have very little utility in preventing the spread of the virus. For starters, most people have no idea how to wear a mask. So if you just watch people with their masks on, notoriously, they're every 30 seconds, they're touching it, they're adjusting it, they're scratching their nose. And as soon as you do that, you render the mask basically useless. In addition, there's been several studies, not for COVID, but for influenza and the common cold, looking at the ability of a mask to prevent infection. The conclusion was they don't work very well. Nobody's done studies on COVID yet, but we're speculating that if you wear a mask, it may offer some protection. And we believe that there's some false sense of security by having a mask over our face, even though there's very little scientific evidence to support that.
Is there data to show that if I am at the grocery store and I see that old woman and I don't have my mask on, that I'm more likely to give it to her?
Well, the data shows clearly if you are ill with the virus and you sneeze or cough directly in her face, that's how she's going to get the virus. There's little data to support asymptomatic spreading, meaning that you've got the virus, you have no symptoms, and this visual of people walking around crop dusting the population because you have the virus but don't know it just isn't accurate. So if you're sick, don't go to the grocery store. And if you're sick, putting a mask on to prevent your spread to others is not going to help that much. The best way that you can prevent the spread to other people if you're ill is to stay home. The example I like to give is I've got a patient right now who's suffering from stage 4 breast cancer, and she's finishing up a course of chemotherapy. As a result of the chemotherapy, her immune system is beat up. She's much more susceptible to getting infections because her immune system is beat up from the chemotherapy. So what we don't do in her situation is tell all her neighbors in her neighborhood to put a mask on and to socially distance. What we do is to tell her to be extra careful. She stays in her house. When she goes out, she's extra careful. She might stay away from people because she doesn't want to get an infection because her immune system is susceptible to that. We don't tell the whole total neighborhood to put masks on. I mean, that's ridiculous, but that's exactly what we're doing now.
Okay, so whether you wear a mask properly or not, the CDC still recommends that everyone use a mask in public settings as often as possible. Virus transmission is most easily prevented when everyone is wearing a mask, besides children under the age of 2 and certain at-risk cases. Now, it's true that people with a weakened immune system and anyone showing COVID symptoms should stay home. The problem is, this is not always possible for everyone, and as a result of that fact, it becomes necessary for the public to do their part in protecting the most vulnerable by wearing face protection, even people who would consider their infection to be asymptomatic, because even these cases can spread the virus.